Thank you for listening to Depictions Media Radio.
Hola, muy buenos días a todos y bienvenidos a esta sesión informativa de la OPS sobre la pandemia por COVID-19 en la región de las Américas, este miércoles 5 de mayo del 2021. Soy Sebastián Oliel del Departamento de Comunicación de la OPS y esta sesión, como todas las semanas, durará alrededor de 1 hora. Y estaremos tomando preguntas de ustedes hasta ese momento. Ya hemos recibido preguntas por correo electrónico y también podrán enviar sus preguntas por el QIA y hacerlas en vivo. Recuerden incluir su nombre y medio de comunicación al enviarnos sus preguntas. También les Hemisphere, but very few vaccine doses have arrived in Latin America from the United States. And yet, when India had Hola, muy buenos días a todos y bienvenidos a esta sesión informativa de la OPS sobre la pandemia por COVID-19 en la región de las Américas, este miércoles 5 de mayo del 2021. Soy Sebastián Oliel del Departamento de Comunicación de la OPS y esta sesión, como todas las semanas, durará alrededor de 1 hora. Y estaremos tomando preguntas de ustedes hasta ese momento. Ya hemos recibido preguntas por correo electrónico y también podrán enviar sus preguntas por el QIA y hacerlas en vivo. Recuerden incluir su nombre y medio de comunicación al enviarnos sus preguntas. También les cuento que contamos con interpretación simultánea al inglés, portugués y francés y pueden optar por cualquiera de ellas haciendo clic en el botón Interpretation.
You can opt for any of the languages by clicking on the globe icon for interpretation. Dr. Carissa Etienne, Director of the Pan American Health Organization, will tell us how COVID-19 is affecting adults of all ages and also about the situation of ICU units and how full they are throughout the region. Dr. Jarbas Barbosa, Assistant Director of PAHO, Dr. Ciro Ugarte, Director of the Department of Health Emergencies, and Dr. Sylvain Aldigueri, Incident Manager for COVID-19 for PAHO, are with us as well. Now I invite Dr. Carissa Etienne to give her opening remarks. Dr. Etienne.
Good morning, and I wish to thank you for joining today's press briefing. Over the last week, more than 1.3 million people were infected with COVID in the Americas, and more than 36,000 died from COVID-related complications. Nearly 40% of all global COVID deaths reported last week took place right here in our region. Today, more Latin American countries than ever before are reporting more than 1,000 COVID cases a day. And our hospitals are fuller than ever. We are still in the midst of an ongoing crisis. Canada is continuing to report significant jumps in infections in highly populated provinces as Ontario, as well as in less populated territories of the North and Yukon, which are home to remote and indigenous communities. Puerto Rico and Cuba remain significant drivers of COVID cases in the Caribbean, although infections are also on the rise in many smaller islands. Anguilla, for example, has reported nearly 70% of its total COVID cases in just the last 10 days. And in St. Vincent and the Grenadines, cases are increasing among internally displaced people following the recent eruption of the La Soufrière volcano. In Central America, Guatemala is seeing significant spikes in cases, and Costa Rica is reporting record high infections. Across both countries, hospitals are full of patients, most of them under 70 years of age. Cases are rapidly accelerating in the Guyanas and across Argentina and Colombia, where weekly case accounts are 5 times higher than they were this time last year. Hospitals are reaching capacity in Colombia's metropolitan cities, and death rates have jumped by more than a quarter over the last week. Despite all that we've learned about this virus in a year, our control efforts are not as strict and prevention is not as efficient. And we are seeing what happens when these measures are relaxed. COVID spreads, cases mount, our health systems become overwhelmed, and people die. It's an eerily familiar picture, but one thing does look different now, and that is the patients themselves. For much of the pandemic, our hospitals were filled with elderly COVID patients, many of whom had pre-existing conditions that made them more susceptible to severe disease. These trends created a false sense of security among the younger populations, who, while fearful of the virus, were not concerned about severe disease. But look around the intensive care units now across our region, and you will see that they are filled not only with elderly patients, but also with younger people. Over the last few months, hospitalization rates among those under 39 years increased by more than 70% in Chile. In Brazil, the highest jumps in hospitalizations have been among people in their 40s. In some areas of the United States, more people in their 20s are now being hospitalized for COVID-19 than people in their 70s. Adults of all ages, including young people, are becoming seriously ill, and many of them are dying. In Brazil, mortality rates have doubled among those younger than 39. It has quadrupled among those in their 40s and tripled for those in their 50s between December 2020 and March 2021. This is tragic, and the consequences are dire for our families, our societies, and our future. The time is overdue to adjust our response, and countries must be prepared for what's in store. Our region did a remarkable job expanding hospital capacity in 2020. Colombia, Panama, and the Dominican Republic doubled their ICU bed capacity, while Chile and Peru have tripled theirs, and Mexico and Honduras nearly quadrupled their capacities in just a year's time. But still, hospitals across the Americas are dangerously full. With proper care and treatment, young people are more likely to survive COVID infections, but hospitalizations can take weeks, and therefore countries must be prepared for a surge in demand. If infections continue to rise at this rate, we expect that over the next 3 months, countries across our region will need to maintain and even increase their ICU bed capacity further. Health workers also need support after operating in a crisis mode for so long. Where gaps exist, countries need to hire and train more and more specialized health personnel to ensure that every patient is receiving the high quality of care that they deserve. But we also cannot expand ICU capacity indefinitely. There are simply not enough health workers to hire and to train in time. So this points us back to the best option. We must all recommit to a comprehensive response that is grounded in prevention and maintaining healthcare for COVID-19 and other conditions. Just as it was last year, our common goal should be to bring down this epidemic curve. We know what it takes to get there. Social distancing, the wearing of masks, avoiding gatherings in closed spaces are the key to reduce transmission, especially as the dangerous variants of concern circulate. Countries must reprioritize testing and contact tracing at the primary care level to protect the lives and livelihoods of our people. We must also strongly advise those who are sick to isolate themselves to avoid getting others sick. Prioritizing prevention also means that we need to be proactive in our communication campaigns to remind younger working age populations of their risk and the need to protect themselves, including by getting vaccinated when it is their turn. But while vaccines are being rolled out as fast as possible, they are not a short-term solution. We cannot rely on vaccines to bring down infections when there's not enough vaccines to go around. Indeed, they are one part of the comprehensive response that includes prevention through public health measures and improving the readiness of health systems. And that's why we must do all we can to bend the curve, to bring infections down, to save lives, and to ensure access to vaccines. Thank you.
Muchas gracias, doctora Etienne. Vamos a pasar
Thank you,
ahora.
Dr. Etienne. Now we are going to start with our question and answer session. We have questions that we have received, and please include your name and media when you send new questions. We have several questions from journalists from several countries, questions about COVAX, Daniel Colin from 1023 Guatemala, Daniel Rodriguez, Canal 10, Uruguay, Tanya Smith, Cartwright from the Tribune, Nassau, Bahamas, Melinda Ochoa, Mexico, Stetson Bab, Barbados. And let's begin with Kaylin Romero from Confidencial Nicaragua. Has there been any progress with the Serum Institute of India about the shipping of vaccines, and how could this affect those who need a second dose of AstraZeneca vaccine? And also, what is the scenario of sending new lots or batches of vaccine from Korea to Guatemala, Bahamas, Barbados, Mexico, and Uruguay? Jacqueline Bicheda asked if Moderna will be sending vaccines to Latin America, and do we know how many, when, and to what countries? And are countries prepared to receive these vaccines from Moderna, given that they need refrigeration? So, several questions on the vaccine panorama. Could you please answer these questions, Dr. Barbosa? Yes, thank you very much. I'll go one by one. We're still negotiating with the government of India so that the Serum Institute of India is able to fulfill their contracts, the contracts they have with the COVAX facility. The Serum Institute of India has committed to send about 1 billion doses for the COVAX facility. They're a large manufacturer, but given the current situation in India, the government is not yet authorizing the release of doses from that manufacturer. There's a high-level negotiation with the Director General of WHO and others in negotiations with the government of India to try to reach an agreement whereby India can authorize that part of their production be sent to COVAX, and another portion remain in India for their current domestic needs, their need to vaccinate their population. This may influence this may have an influence in the whole world and even our region. There are 3 countries, Haiti, Nicaragua, and Bolivia, in our region who have foreseen shipments until the end of May from India, and in other countries there may be other implications because there will be a decrease of supply of vaccines through COVAX in the month of May, and therefore this negotiation is very important, and important that an agreement be reached so that the Serum Institute of India can provide vaccines for their own country, but also meet and fulfill the agreements through COVAX. We are already in the middle of the second wave of shipments of vaccines for other countries, and this will continue. Let us remember how this distribution takes place. We have a list of countries, a list which was established through a mechanism in Geneva, which was organized by WHO and Gavi. This mechanism has a list of countries, a random list of countries, and we deliver the vaccines according to this list. There is also an international expert committee working from Geneva, and they guarantee transparency. So once we receive the list and we have the negotiations with the manufacturers to have assured information about the amount of vaccine they have, we will begin to deliver vaccines, and we will inform the countries what date, what amount, and what flight. Guatemala received on April 28, received 320,000 doses of vaccines, and we are negotiating with the manufacturers so that Guatemala, as well as the other countries in the region, may receive the doses that are missing so that they can complete the cycles and assigned for the period, and what has been assigned for the period until the end of May. There are still 430,000 doses pending that Guatemala is receiving. Regarding Moderna announced this week an agreement to provide vaccines through COVAX. This is an excellent piece of information. About 36 million are going to be provided this year. The rest will be provided during the first half of the year 2022. Most countries in the region are in conditions of receiving Moderna's vaccine. This vaccine requires storage under freezing conditions that are similar to other vaccines that are used in the region already. So most countries are ready indeed to receive Moderna's vaccine. Countries in Latin America and the Caribbean will be receiving Moderna vaccines as well as from other manufacturers. When a manufacturer makes an agreement with COVAX, they must provide the vaccines, and the vaccines are distributed. For example, if there are 10 million doses available for the first week in June, that is distributed throughout the countries in an equitable and proportionate manner. And so for Moderna, Pfizer, that is planning to be providing vaccines starting in June in Latin America and in July as well. So all manufacturers will have vaccines ready to be distributed in Latin America and the Caribbean. Thank you. Thank you, Doctor. The next question is from Belisa Godinho from W Magazine in Portugal, and from Paula Lindo from Trinidad and Tobago Newsday, and is in English. Belisa said,
situation on the new Indian COVID variant in the PAHO region. Y Paula Lindo dice, how important is it for a government to know how many cases of a particular variant of concern are present in a country? Dr. Aldigueri?
Yes, thank you for these questions, both related to the genomic surveillance in the Americas. But first, I'd like to provide you with some background and update regarding how the genomic surveillance is working in the Americas. And I'd like first to note that countries of this region have started years ago using the genomic surveillance for tracing outbreaks, cholera, foodborne diseases, chikungunya, Zika, yellow fever. And now this really long experience is applied to SARS-CoV-2. So at the moment, as of today, we have 15 countries and territories in the Americas with the capacity to do genome sequencing in at least one laboratory. Many countries have different laboratories in this doing genome sequences. And very soon, 2 more countries will join this group of 15 countries to doing genomic sequencing. In addition, during the last 2 months, we have been able to increase the number of regional reference laboratories from 2, the Fiocruz in Brazil and Instituto de Salud Pública in Chile, to 6, with now 4 more laboratories joining this group: INDRE in Mexico, the Gorgas Institute in Panama, the US CDC in Atlanta, and the University of West Indies in Trinidad and Tobago. The mission of these reference laboratories is to assist countries that have not reached a sequencing capacity yet. So they are processing the samples. PAHO is coordinating the network, provides the countries and the laboratories with reagents, organize trainings, updates, and also covers the cost for shipment of the viral samples to the reference laboratories. For this important pillar of the regional response to the pandemic, I'd like to highlight that we are receiving support from the US CDC and from the Rockefeller Foundation. Now, regarding the question from Portugal, it is important to mention that the variant predominating now in India is named B1617 and has replaced previous variants that were circulating in this country, India. There is only a report of detection of 1 case of the B1617 in Mexico that has been reported to PAHO through the International Health Regulation Channel. It hasn't been detected as of today in any other country of the region of the Americas. In Mexico, very important to mention that contact tracing activities are being implemented for the genomic surveillance, fully articulated with the epidemiological surveillance, in order to detect any unusual or unexpected increase in cases, increase in lethality, or change in clinical patterns, because these aspects may be associated to a particular variant. Nevertheless, once a variant is detected in a particular area of the country or a particular country, and the transmission is established, it is not necessary to keep counting all cases corresponding to the same variant. The most important aspect is to monitor the proportion of the newly detected variant among laboratory confirmed cases. So I hope that I have answered both the concerns of the 2 journalists and also provided you with an update regarding the regional network for genomic surveillance in the region of the Americas. Thank you.
Gracias, doctor.
Thank you, Dr. Aldigueri. Next question from Carrie Can from NPR in the United States. And there's a similar question from Kaylin Romero from Confidencial from Nicaragua. Carrie Can, in English, the question reads:
reliable are the COVID-19 figures that we are getting from the Nicaraguan government at this time? Has the government implemented PAHO recommended practices? And if not, what is PAHO recommending Nicaragua to do to manage the pandemic? Dr. Ugarte?
Thank you for this question. In order to do a comprehensive risk assessment in all the countries in the region, PAHO uses official information that is channeled through the international health regulations, information that is provided officially by the countries. We also use other reliable sources of information. We also look for information that is published in the media, and also use information on the neighboring countries as to analyze what are the trends and the situation, particularly in border areas. So with all that, we analyze the situation and we can report on what is happening inside the country. As you well know, there are discrepancies between the official reports and other sources. But even considering the official reports, we can see an increase of number of cases in the last week. And it's a trend that is been happening from some days before. And in that regards, we have been working with the government of Nicaragua and other partners, and our recommendations are being implemented in several areas, not only by the government, but also by other partners, as I said. And we think that this process will help Nicaragua to control the pandemic in a better way. So we emphasize on the detection of cases. We emphasize on the surveillance and monitoring of the cases, but also the contacts to implement social distancing and other public health measures, and also to vaccinate the priority groups. So all that information must be available for the population to take the proper measures, but also for the international community to continue supporting Nicaragua with donation of vaccines or other means of support for the Nicaraguan population. So this is a joint work, and we expect that this work will be better as we go forward. Thank you.
Gracias, doctor. Ahora me gustaría darle la palabra a Kadim.
Thank you, doctor. Now I would like to give the floor to Kadim Joseph from Antigua and Barbuda. Kadim, you have the floor.
Thanks for having me. My question is, in recent days, residents here in Antigua and Barbuda have been debating the prospect of mandating COVID-19 vaccines. What is PAHO's stance on making COVID-19 vaccinations mandatory in order to reach herd immunity, as well as offering incentives like food vouchers to encourage people to get vaccinated? Thank you.
Thank you, Kadim. Dr. Barbosa.
Thank you, Kadim, for this question. PAHO does not recommend the use of mandatory measures or vouchers to encourage people to get vaccinated. Of course, this is a decision that every country can make, but in our perspective, the most important measure to guarantee that the people will get vaccinated is to provide the right information to the families, to the communities. So this is very important that each Ministry of Health needs to develop a very comprehensive communication plan. It's very important to reach out to every physician, nurse, health worker in the country, explaining what are the benefits of the vaccine, why people should be vaccinated. So when a family or a person goes to a doctor for any other reason and they have some doubts about a vaccine, can ask it to the nurse, to the physician, and receive the proper information. It is also very important to use not only the traditional media vehicles, but to use the social media, to use Facebook, Twitter, Instagram, and other vehicles to provide the right information to the people. We believe that this is the best way to encourage people to get vaccinated, to show clearly the benefits to get vaccinated, that vaccines are saving lives already and can protect you, your family, and your community. This is a very important measure that every country needs to have as a priority in their national vaccination plan. Thank you.
Gracias, doctor. La siguiente pregunta es de Steven Civilien
Thank you very much, Doctor. The next question is by Steven Civilien from St. Martin.
With the COVID-19 management put in place by Caribbean countries in the fight against the virus. Dr. Alighieri?
Thank you, Mr. Civilien, for this question regarding the Caribbean. The Caribbean is a mosaic of people, islands, mainland countries, and also a mosaic of economies. But it's also a mosaic of different patterns of transmission of the COVID-19. The unique situation of the Caribbean is that its economy depends on tourism, therefore on international travels. And I would say that this is the most important aspect, complex aspect of the response in the region of the Caribbean. As in all South America, as in many countries of Central America, the Caribbean region is facing now a new surge of cases. This surge has started late 2020, early 2021, following the resuming of non-essential travels to the Caribbean islands, and also related later to the spillover of the new wave in the northern Amazon to the countries of the Guyanese Shield, namely Guyana, Suriname, and French Guiana. Countries of the Caribbean during 2020 have used very efficiently public health measures, including lockdown and travel bans for bending the curve. The countries have strengthened their surveillance systems, including the laboratory surveillance. All countries and almost all territories have implemented their own PCR diagnostic. Many of them are using antigen rapid test as part of their testing strategy. So this was 2020. In 2021, all countries in the French, Dutch, and English-speaking Caribbean have started rolling out of vaccination response activities, sourcing vaccines through different mechanisms, bilateral deals, diplomatic agreements, COVAX mechanisms, and some countries are progressing very quickly in administering the vaccine to a large part of the population. This is an example that all countries must follow. I'd like also to highlight our special concern regarding the complex humanitarian emergency that is occurring in St. Vincent and the Grenadines, with a high proportion of people that are internally displaced following the eruptions of La Soufrière volcano. The population living in shelters are at risk for COVID-19 infections, higher risk of COVID-19 infections. So in conclusion, in this mosaic of epidemiological situations, Caribbean countries and territories have experience and have access to all the tools for bending the curve and saving lives. The combination of public health and travel-related measures, very strictly implemented, very strictly monitored, and also a proactive vaccination program is key for controlling the transmission of SARS-CoV-2 in the Caribbean region. Thank you.
Gracias, doctor. Tenemos varias preguntas.
Thank you, Doctor. We have several questions in connection with Venezuela. Oswin Barrios from Fe y Alegría, Mariana de Barrios from Venezuela, and Gabriel Bastidas also from monitoreamos.com are asking about Venezuela and COVAX. They're asking whether PAHO was able to receive the second payment by Venezuela in connection with the COVAX vaccines and when they would be reaching Venezuela. Dr. Ugarte. Thank you very much for those questions that we see through the chat, but also for this specific COVAX-related question. PAHO does not receive payment for COVAX. This is a payment that is made to Gavi, or that is when the agreement is reached. And when PAHO purchases the vaccines, they can receive payment for that portion. The second payment by Venezuela would be made directly to Gavi, and it was publicly announced. We have no confirmation of that payment. We expect for the payment to be made soon, and with that, Venezuela would be eligible for the second vaccine distribution plan. Those vaccines will be analyzed by the advisory group as well as the COVAX decision-making group, and depending on the type of vaccine and also the types of vaccines, the countries will be informed, Venezuela among them, as to timing. There is no specific time, but it is expected to happen in late June, early July. We hope for this to happen earlier. We know that the restrictions on vaccine production and also the surge in the number of cases in vaccine-producing countries is reducing the availability of vaccines for the other countries, including Venezuela, and this is clearly one of the countries that has fewer vaccines per population. And to that end, we reiterate our call for all the actors to facilitate access to vaccines in Venezuela for frontline workers, health workers, individuals with comorbidities, and at the same time, since the vaccines will not be available in quantities that are sufficient to implement public health measures that have been proven effective. Thank you very much. The next question is by Sarah Durbin from DEVIX on what the director mentioned in connection with the situation in ICUs in the hospitals in the region. And in English, her question is,
countries are you most concerned about in the region in terms of health systems becoming overwhelmed? Dr. Etienne?
So thank you, Sarah, for this question. Frankly, we are concerned about all of the countries in our region because they all face difficult prospects. We have analyzed the impact on hospital services of the COVID pandemic over the last year in some 16 countries. In March of 2020, they had 61,406 ICU beds with an average occupancy rate of some 61%. By April of this year, these countries had already expanded to 121,000 ICU beds. But importantly, about 80% of these increased ICU beds were occupied. And that's an average. But some countries had more than 95% occupancy rates in their intensive care units. So despite a significant expansion in capacity, hospitals have quickly filled up again as more people fall seriously ill with COVID-19. With increased numbers of younger patients and the longer hospital stays in some countries like Brazil, Chile, Paraguay, and Peru, the needs for ICU bed, as I mentioned earlier, increases. And let's face it, it's not only beds that we need to care for people. As I've said before, each of these beds requires highly trained doctors and nurses with knowledge of intensive care and the specialized nurses who can care for these very ill patients 24 hours a day. This is intense care. So the strain on our human resources has been unprecedented. And frankly, we don't yet see the light at the end of the tunnel. Medical oxygen is vital for many of these severe and critical patients. We have mounted a major effort to support the surge capacity in these countries. Patients in clinical care need oxygen, and the longer they stay in hospital, the more oxygen they need. And our hospitals are hard-pressed to keep up with that increased demand for oxygen. Our countries have managed to double their intensive care capacity, but this may not be sustainable over time. Quality standards and patient safety depend on adequate, well-trained personnel and equipment. And I need to say personnel that are not overstretched as well. These both are suffering under the strain of the increased cases in most countries. And at the same time, we have also seen disruptions to outpatient services and the other normal disease prevention activities. The first level of care, the primary care level, has been predominantly affected, and this has implications for vulnerable populations. But we cannot yield to these difficulties. We are supporting the countries in vital areas, including the procurement of medications and supplies, oxygen management strategies, the deployment of rapid tests to improve surveillance and response, supporting in sourcing other supplies, and in some other areas. We are also supporting countries in expansion of their hospital capacity, including the surge capacity, such as with the emergency medical teams and alternative medical care sites where appropriate. I want to assure you that we will continue to work together so that countries can overcome these obstacles. But the challenges are unprecedented. However, we must get through this pandemic for an eventual return to normalcy. So we all must play an important part. Over. Thanks.
Gracias, doctora Etienne. Siguiente
Thank you,
pregunta.
Dr. Etienne. The next question is by Michael Stott from Financial Times, and it reads,
Major partner in PAHO and the richest country in the hemisphere, but very few vaccine doses have arrived in Latin America from the United States. And yet, when India had a recent crisis, the US offered help immediately. What should the US be doing to help Latin America and the Caribbean get hold of vaccines now? Dr. Barbosa?
Thank you for this question. It is very important that the US, the European Union, and other developed countries in the world could provide more support to the developing countries. I think that this is really not only an ethical and moral imperative, but from a public health perspective, if we want to control the transmission, we need to work everywhere. We need to support every country to get the access to more vaccines, to get the access to the medicines, and they need medicines in order to respond in each country to the pandemic. The US has recently announced their $2.2 billion donation to COVAX. This was a very important step. It was the first donation from the US to the COVAX facility. And also when we are still having a very important crisis in Brazil related to medicines that are used in the ICU, some ICU procedures. The Pan American Health Organization is working with the US government and the Brazilian government to facilitate a donation from the US to Brazil. So I think that these are first steps, but our director has sent a letter to the US government asking the US government if they could donate some vaccines that they will not use to countries in Latin America and the Caribbean. So I think that it's very welcome, this participation of the US in the response, because the US is a very important country, the richest country in the world with so many resources. And indeed, I think that if they can exercise more this solidarity with the neighboring countries in Latin America and the Caribbean, for sure that this will be a very important support to these countries, and we need to welcome all initiatives to support the countries in Latin America and the Caribbean. Thank you.
Gracias, doctor. Siguiente pregunta es de Kevin Feldman.
Thank you, doctor. The next question is by Kevin Feldman from Guardian Media in Trinidad and Tobago, and the question will be in English.
De restricciones,
and it describes the situation with restrictions in his country, and he asks,
have lockdowns or shutdown of businesses activities shown to help decrease the spread of COVID-19? If so, please explain how it helps. Y también dice, given the frightening situation in
And he
India.
also says, a la luz de la situación que realmente asusta en India, la OPS podrá ayudar al país para navegar dicha catástrofe si se quedan sin insumos y en tal caso, ¿cómo? Doctor Aldiguieri. Muchas gracias por esta pregunta en lo que hace a la situación y respuesta en Trinidad y Tobago. Y en primer lugar, hay que observar que la misión de la Organización Panamericana de la Salud es asistir a los países durante este momento y también en momentos de pandemia. Entonces, sí, nosotros podemos ayudar. Me gustaría observar que el Ministerio de Salud de Trinidad y Tobago informa al OPS a diario casos a través de los canales oficiales. Al día de ayer, Trinidad y Tobago había notificado una cifra acumulada de 11.477 casos y un número de 1.079 muertes a partir del comienzo de la pandemia. El Ministerio de Salud notificó las últimas semanas y hemos observado que las tendencias aumentaron drásticamente en lo que hace al número de casos nuevos. Entonces, en este momento de la pandemia, en muchos países del Caribe y en todos los países de América del Sur, las medidas de salud pública que incluyen el cierre de las instalaciones son la manera para aplanar la curva epidemiológica. Las medidas de salud pública, cuando se implantan de manera estricta y se vigilan de manera estricta, inciden en la tasa de reproducción de la pandemia y con ello esto será útil para reducir la cantidad de casos graves y se disminuirá la carga en los servicios de salud, entre ellas las terapias intensivas. Pero también me gustaría destacar los esfuerzos y el arduo trabajo del Ministerio de Salud,
including the laboratory surveillance, which is coordinated by the TPHL, and including now with the participation of the University of West Indies for genomic
la
surveillance.
Universidad también de las Indias Occidentales en lo que hace a los estudios que se están realizando desde el punto de vista genómico para el SARS-CoV-2. Entonces, ¿cómo la OPS puede ayudar? La OPS ha creado herramientas, pautas, técnicas, mecanismos de adquisiciones para ayudar a los países que se enfrentan a un nuevo pico de contagio. Esto incluye también la gestión del oxígeno e incluye también la cadena de suministros de oxígeno, el uso y el acceso a medicamentos para las terapias intensivas, medicamentos, insumos para la intubación y también la organización de los servicios sanitarios, y esto incluye también, por ejemplo, el aumento de las intervenciones de salud pública para disminuir la incidencia en las camas hospitalarias. Entonces, la OPS, a través de sus representaciones en los países y el equipo en Puerto España, está participando plenamente para ayudar al Ministerio de Salud y mantenemos una relación realmente sólida con las operaciones que se realizan desde el centro aquí en la sede en Washington, D.C. Espero haber respondido a la inquietud del periodista. Muchas gracias. Thank you, Doctor. The next question is by Katia Rojas Toro from Destino Panama and Gerson Conjave from El Comercio in Peru, and this is regarding vaccination of teens. He's saying that it is quite likely that some vaccines are authorized for teens in the upcoming days, and this would be done by regulatory agencies in the US and Europe, and he would like to know what PAHO's position is in connection with the vaccination of youth between 12 and 16 years of age against COVID in the region. Dr. Barbosa. Thank you. Thank you very much for this question. It is positive to expand studies to confirm that vaccines against COVID-19 may also be safe for teens and children. That is very good, because that means that at some point in the future, if those vaccines will be used, we will have data to confirm that they are safe and efficacious for those age groups. But it is also important first for the regulatory authorities to say that they can be used. They are not saying that they must be used. The ones that must use those vaccines are the ones that are the parties that need to determine the mandatory nature of those vaccines are those that are determining the vaccination schedules in the countries. WHO and PAHO's recommendation is to use those vaccines first to save lives and also to maintain the operation of health services. The vaccines may be used for several goals. When at the current time, with limited access to vaccines, the priority should be health professionals and other professionals from social areas that are in the front line, so that the hospitals, the health centers, and the essential services are able to continue to operate. Second, to save lives and to protect the most vulnerable population that has the highest risk to develop a severe form of COVID-19 and die. These would be the elderly and also adults that have some health condition, hypertension, diabetes, cancer, obesity, and some other comorbidities that may be a risk factor for a severe form of COVID-19 and also lead to death. That could be the main goal. And only after reaching this goal should the access to the vaccine be enhanced so that we can have a broad vaccine coverage in the region. That is WHO's and PAHO's recommendation. We do not recommend using vaccines in teens at this time. First, because the studies have not been completed in connection with the safety and efficacy of those vaccines, and also because they are not priority groups, as our director mentioned at the outset. With the goal of saving lives, we should be using the vaccines in this manner, and they are not going to have an impact on the transmission of COVID-19 in the short time. So the vaccine should be used to save lives, to protect vulnerable population, together with the public health measures that may diminish the speed of transmission. Thank you. Thank you, Doctor. The next question in English is from the Miami Herald. Says Stenson Charles. There are several questions, and he says,
what percentage has gone to Latin America and the Caribbean? Also, PAHO has said 500 million people in Latin America and the Caribbean need to be vaccinated to reach herd immunity. At the current rate of vaccination, what is the estimate on when that will be reached? And finally, what's the status of vaccine deliveries to Haiti? Dr. Barbosa?
Okay, many questions. Let me be very brief. Let me start by the end. Haiti has not received, unfortunately, vaccines through COVAX. Haiti has around 700,000 vaccines that were allocated to Haiti, but the government of Haiti is still in the process to finalize the arrangements that all the other countries have made to be able to receive these vaccines. Haiti is one of the 10 AMC supported countries in the region, so Haiti is not paying for these vaccines, but the country needs to make some legal and administrative arrangements. Our country office in Haiti is supporting the Ministry of Health to get everything ready to receive these vaccines. The second is that the access to vaccines is very limited during the first semester. In the second semester, we will have more vaccines, but I think that is too early to make any kind of estimation about when the countries will reach the 70 or 80% that we think that will provide the herd immunity. I think that is too early to make this kind of estimation. The main objective now is to get more vaccines to reach the 20% of the population that will include all the most vulnerable groups that needs to be reached as soon as possible in every country. Third, Latin America and the Caribbean has received so far around 15% or 15% of the total vaccines that COVAX has deployed. But every country in Latin America and the Caribbean will receive by the end of May around 2.2% of their population, as well as all the other countries that participate in COVAX facilities. So every country in Asia, in Europe, in Africa, in Latin America and the Caribbean are receiving exactly the same proportion of their population, around 2.2%. The exception is are the small islands in the Pacific, in the Caribbean, that have a small population. So for logistic reasons, they are receiving around 16, 15, 20% of their population. So the COVAX is providing an equitable access to all the countries based on their population and the ratio that they requested to the facility. Some countries requested 20%, other countries 10%, but all of them are receiving a similar proportion of the vaccines. Thank you.
Gracias, doctor. Todavía nos quedan algunas
Thank you,
preguntas.
doctor. We still have some questions, so we will be going over time today. So the next question is by Melina Ochoa, and I would like to give the floor to Melina for her question.
Hola, ¿qué tal? Muy buenos días. ¿Me escuchan?
Sí, adelante.
Muchas gracias. Saludos a todos desde la Ciudad de México.
Can you hear me? Yes, thank you very much from Mexico. And I have a doubt in connection with the population in Mexico and the fact that we already have new variants of concern, such as the South African variant or variants of interest, such as the one detected in India. So how should this be interpreted by the Mexican population? Should we double our efforts with our health measures, or should we, or these variants do not have any further meaning in connection with the pandemic?
Melina, doctor Aldiguieri.
Sí, gracias, señora Ochoa, por su pregunta. So,
Dr. Aldiguieri, thank you very much, Mrs. Ochoa, for your question. I am going to start with an issue that I think has been mentioned several times. The emergence of variants is a normal process, a biological process, and it is expected as a mechanism for the evolution of the virus. And even though some of those variants have shown to have greater transmission capacity, there is no evidence so far to infer that they can be more aggressive or more lethal. So far, all of the control measures that have been implemented, such as the use of masks and social distancing, have proven to be effective to stop the transmission of any variant. Now, in Mexico, INDRE is leading a genomic surveillance network at the national level that has allowed to detect timely the variants that are currently circulating in the country, and it is very likely that they will identify other variants that may be imported or variants that may emerge in the country. So Mexico, through its national network, has the ability to detect, to sequence, and also to compare the variants that are detected and circulated in the country against the international databases. So the variant of concern that was initially detected in Great Britain was confirmed, the variant of interest that was detected and initiated in Mexico itself, and also the variant of interest from India, and this has already been reported to the international community through the channels established in the international health regulations. But I would like to highlight that at the same time, the health authorities in Mexico have been reporting through various press briefings the various pieces of information to avoid panic and also to implement preventive measures in the community. The cases were assessed, and also the potential outbreaks associated to the various variants were identified, including also the variant of interest that was first detected in India. And in this case, the contacts are being tracked.
I should add that the PAHO team in Mexico is in constant contact with the counterparts, including the health ministry, but not exclusively. And a recommendation is made to reactivate a prevention campaign as well as compliance with public health measures and keeping a communication strategy. I hope I answered your question. Thank you. Thank you. We have last few questions. Next one from Anthony Battle from Reuters in Brazil in English, and it reads,
did not improve the importing of the Sputnik V vaccine, arguing that it contained replicating adenovirus. Russia says no replication competent adenovirus was found in any of the Sputnik V vaccine batches that were produced. Who is right in this matter, or is it a case of different levels of RCA that are permissible? Dr. Barbosa?
Thank you for this question, because it will allow me to explain very briefly what's the role of the national health regulatory authorities and what's the role of WHO about the recommendation, authorization of vaccines. Each country has sovereign right to make the assessment of the vaccines and medicines and to give a license to them. So Anvisa in Brazil and other authorities in Latin America and Caribbean and even in the US or Canada, they are reviewing all the dossiers that the producers present and make their decisions based on the analysis that they performed about these dossiers. They don't need and they don't consult PAHO or WHO to make this assessment. What we do, PAHO, is to support the development and the strength of the national regulatory capacities. Since almost 20 years now, we perform regular assessment of the national health regulatory authorities in the Americas, and from this assessment, we can establish a plan of action to support them to strengthen their regulatory capacities. Anvisa is one of the 8 regulatory authorities of reference that we have in the Americas. So they made the assessment and they give the reasons about their decision. WHO has a pre-qualification team in Geneva, and this team can give a pre-qualification to a vaccine or a medicine, or in the case that we have now during the pandemic, they give you emergency use listing. So they give the authorization for these vaccines to be used during the pandemic. PAHO, through the revolving fund, we only purchase the vaccines that have authorization, this emergency authorization from WHO. The Gamaleya Institute had an initial contact with the pre-qualification team in Geneva, and they said that they will provide information about the Sputnik vaccine to WHO. So we can only say anything about the Sputnik vaccine after the WHO pre-qualification team has received all the information and make the assessment about the quality of production, the safety, and the efficacy of the vaccine. So, in short, we cannot say anything about what we don't know. Only after this assessment by WHO, we can say what is the situation of the Sputnik vaccine. Thank you.
Gracias, doctor. Ya estamos llegando al final de la sesión de prensa de hoy.
Thank you, doctor. We are coming to the end of our press briefing of today, and the last question has to do with the vaccines. About the vaccines.
Countries are vaccinating large numbers, but other countries barely have enough for 2% of their population. Some people only want certain vaccines, and some people and health workers are reluctant to be vaccinated. What do you say to those people, Dr. Etienne?
Thank you for this question. I think we should make a very important point that COVID-19 is easily transmitted. It seems this is even worse with some of the variants of concern. And this can lead to long-term serious illness and death, even for people who are young and healthy. Effective COVID-19 vaccines exist, and are one important way to protect people from this disease. You heard Dr. Barbosa. We still do not have enough doses of COVID-19 vaccines for the entire population in Latin America and the Caribbean. We need more vaccines, and we are advocating at the highest levels for increased supplies from manufacturers, for donations from countries that have excess vaccines. We in PAHO, we consider that our frontline health workers, we consider them as the highest priority for vaccination because they are at the higher risk of being infected with COVID-19. And there is also a risk that they can spread COVID-19 to people like their patients, their families, people who are also at high risk of complications or death. I think it's important to note that our health workers have been working under intense and challenging conditions for more than a year, and they put themselves at really higher risk to help others as part of the COVID-19 response. And health workers are especially important for immunization because they constitute the most trusted source of information on vaccination. So we really have to work with our healthcare workers to ensure that they fully understand all that there is about COVID-19 vaccines and that they are able to be a source of information. We want to urge them to listen to people's concerns, to acknowledge them, and to correct any misinformation, rumors, or misperceptions that are circulating, and to emphasize the safety of the vaccines and their benefits in preventing diseases. But of course, to do that, they themselves have to be convinced. They have to avail themselves of the information, and our ministries of health, supported by PAHO, we have to work particularly with those who are on the front line of distributing of vaccines. So I understand that people may have questions about the COVID vaccines, or of course they might have seen things online or in the news that make them question whether they or their family members should get these vaccines. I understand wanting to make sure that you are making the best decision, and I think that is commendable. But let me take this opportunity to reassure you again that the vaccines will protect you against needlessly suffering from COVID or dying from COVID, and they are safe. So how do we know this, that they are safe? Vaccine safety is always a top priority. All vaccines go through the same process of trial phases before they can be approved for use in the population. And these trial phases aim to ensure the safety of the vaccine, if and how well it can protect against the disease, and other aspects like the number of doses that will be required and who should be vaccinated. The vaccines that have been approved by WHO, who have received the emergency use listing that Dr. Barbosa referred to, they are safe and they do protect us against COVID. Yes, we have heard informally that some healthcare workers, especially in the Caribbean, are worried about vaccines due to the same myths and concerns that have circulated in the general public. We continue to work with ministries of health and communication specialists to really understand these concerns about getting vaccinated and to work with healthcare communities and healthcare leaders to improve vaccine uptake, to dispel those myths, and to urge everyone to get vaccinated as soon as they are eligible and as soon as vaccines are available. So let me end by reminding you that the best vaccine is the one that's available and offered to you. We encourage people not to wait for your preferred vaccine. And remember, vaccines are only part of the preventive effort. At this particular time, with the limited doses, we need to rely on the other public health measures of physical distancing, the wearing of masks, the not congregating in closed environments, and countries, authorities have to look at other more conditions or other more interventions like lockdowns and more restrictions. Let us each take a responsibility for ending this pandemic. Let's do our part. Thank you.
Muchas gracias, doctora Etienne.
Thank you, Dr. Etienne. And now we have come to the end of our press briefing today. And let me remind you that you can find more information on COVID-19 on PAHO's website. There you will find the latest epidemiological alert about the increase in hospitalizations and deaths in patients under 60, as well as information about deliveries of COVAX vaccine and vaccination in general. Again, thank you very much for being with us today, and we'll see you next Wednesday. Have a great day.
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.